Good afternoon. Our last topic is hepatitis B vaccination. Next, please. What is hepatitis B? Hepatitis means inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can also cause hepatitis. However, hepatitis is often caused by a virus. In United States, the most common hepatitis viruses are hepatitis A virus, hepatitis B virus, and hepatitis C virus. Acute hepatitis B is a short-term illness that occurs within the first 6 months after someone is exposed to the hepatitis B virus. Chronic hepatitis B can cause serious death problems, including liver damage, cirrhosis, liver cancer, and even death. So, muna siya ang hepatitis B, or same lang yapon siya sa kaning hepatitis A, inflammation of the liver lang gihapon. Then, ang acute hepatitis B is short term lang siya, within 6 months pa nimo mabatyagan kung ano ang iyang mga simptomas. Then, ang chronic hepatitis B, ato na makadamage na siya sa aton nga liver, kag kung hindi matreat is makakause na siya sing death. Next, please. So what is that mode of transmission or exposure? Hepatitis B, how is hepatitis B spread? Hepatitis B is spread when blood, semen, or other body fluid infected with the hepatitis B virus enters the body of someone who is not infected. So people can become infected with the virus. Hepatitis B is not spread through food or water sharing, eating utensils, breastfeeding, hugging, kissing, hand-holding, coughing, and sneezing. So, paano daw ko na mag-spread ang hepatitis B? Mag-spread ni siya through blood, blood transfusion. Kung may hepatitis ng blood nga tao, mabalhin sa imo kung hindi to mabantayan ang dugo. Tapos sa semen or sa mga through intercourse, magtakdanay ka mo sa inyong matakdan kagyapon sa hepatitis B. Tapos, ang ginahambal diri ang hepatitis B daw kuno hindi daw kuno siya ma-spread through food or water or by sharing, eating utensils, and also in breastfeeding. Unlike sa virus karon nga ginatubang naton, no, even sa sneezing and coughing lang matabugan kang sang virus, malatnan ka na. Mas worse gid ini. Next, please. Other transmissions pa, sharing items such as toothbrush, razors, or medical equipment like glucose monitor with infected person. So amo makatakod yapon to sila kung mag-share ka mo sa toothbrush abi naka-enter na abi na sa inyo nga mouth. Tapos ang razor, di ba? Kung mapilasan ka sa tong razor nga gigamit sing may hepatitis B nga tawo, napilasan siya sa tapos ang dugo nagpabilin dito, kagamiton mo man, mapilasan ka man, ang dugo niyo mag-mix to, amo na maintiran ka na sing virus to. Tapos direct contact with the blood of open sore or uninfected person, amo tong siling kogena. Tapos exposure to an infected person's blood through needle stick or other sharp utensils. Amo gyapon to mapilas ka sang nakapilas sa ila nga waay na hugasan o na disinfect. Malatnan ka gihapon. Next, please. So, what is the symptoms and causative agents of hepatitis B? The causative agent of which is known a hepatitis B virus or HBV. Signs and symptoms of hepatitis B range from mild to severe. They usually appear about 1 to 4 months after you've been infected. Although you could see them as early as 2 weeks post-infection, some people, usually young children, may not have any symptoms. So ang hepatitis B daw ko, no, within 4 months, mabatyagan mo na nga infected ka na, although pila pa lang ka weeks, mabantayan mo na. Unlike sa mga young children nga hindi sila maghatag-sing mga symptoms, amo na kailangan ang vaccination kag ang check up. Next, please. Hepatitis B vaccines, history and characteristics. Dr. Burrow Blumberg, who received the Nobel Prize for his discovery, discovered the hepatitis B virus in 1965. Since 1971, the blood banks started using tests to screen dominations. The incidence of hepatitis B infected has decreased by 25% in 1981. The Food and Drug Administration, or FDA, approved the more advanced plasma-derived hepatitis B vaccine for human use. A second generation of Genetica was established in 1986 as a result of the research. So ang discover gali isang hepatitis B virus si Dr. Burrow Blomberg in the year of 1965. So amo din to at that time nga ang mga blood banks gina-screen na nilang mga dugo nga ginadonate sa ila kay para ma-lessen ang pag-transfuse o transfer sang hepatitis B. So pag ipagbuhat nila sa to, nag-lessing 25% ang ilang cases dito. Tapos nag-amat-amat na dayon, sila sing discover sing vaccine at the year of 1986. Next, please. Symptoms. Ari ang mga symptoms ng hepatitis B, abdominal pain, dark urine and fever, joint pains and loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin, and white of your eyes or jaundice. So, magasakit-sakit imo tiyan, ito mga dark nga imo ihi, tapos imo may mga pamaol na yung mga joint pains ka na, tapos di ka gana magkaon, tapos luya, si suka-suka, gapangilo ang panit nimo, amo na the symptoms na siya nga may ara kasi hepatitis B. Next please. Hepatitis B vaccines available. Hepatitis B vaccines is indicated for prevention of infections caused by all known subtype of hepatitis B virus. Hepatitis B vaccines are available as a single antigen formulation and in combination with other vaccines. So pwede siya single lang siya nga formulation, pwede po siya with combination sa ibang nga mga vaccines. So of the three single antigen HEPV vaccine available in United States is NG-Rex-B from GlaxoSmithKline and Recombrax HB from Merck are approved for vaccination starting at birth. So starting at birth, amuto sila ang pwede na ipang bakuna para sa anti-hepatitis B. Recomvivax HB is approved for the use in individuals of all ages. So, ang Combivax, pwede siya sa tanan nga edad, pwede siya i-vaccine. Hepatitis B vaccines available under the following different brand names. So, amo na gaya ni sila si Energix-B and Recombrax HB. Next, please. Hepatitis B immune globulin and HB vaccine to infant of HB is EG plus mothers are 90% efficacy. All infants, children, and adolescents who were not vaccinated at birth or vaccination. This is the hepatitis B indication. Vaccination of adults at risk of infection. Tapos sexual, household contacts, tapos injections of drug users, long-term residents in prevalence areas, tapos in occupation naman po. Munis lang mga indication sa hepatitis B. Next, please. Hepatitis B dosing. There should be at least 4 weeks before doses 1 and 2, at least 8 weeks between doses 2 and 3. The minimum interval for the overall series from the dose 1 to final dose is 4 months or 16 weeks. Infants should receive the final dose of hepatitis B vaccine or in after 6 months of age. Otherwise, long-term immunity will be impacted. Adult who are immunocompromised or katong mga marasakito ng mga tigulang or on dialysis required large dose of hepatitis B vaccine. The NG-Rex B dose required 40 microgram per 2.0 ml. Use the adult of 20 microgram per ml formulation on a schedule of 0 to 1, 2, and 6 months. For Recombivax HB, a special formulation is available. The dose of 40 microgram per 1.0 ml given on a schedule of 0, 1, and 6 months. So amo na ni siya ang mga dosing no nga ginasiling ang ang naka-indicate diri is ang immunocompromised atong mga tao nga masakiton nga mga malam na o katong ginadialysis dapat taas ang dose sa ilang hepatitis B vaccine kay para mag-effect gid compare sa katong mga waay pasing mga sakit. Next please. Hepatitis B contraindications. Ano siya mga contraindications sang hepatitis B? Allergic reaction after a previous dose of any component of hepatitis B vaccine. Number 2, allergic reaction to yeast. Tapos number 3 is allergic reaction to neomycin. Contraindication to Twinrix. Amo ni siya ang mga contraindications niya no mga kung may mga allergic kita. Next please. Next, please. So, ari na ang hepatitis B vaccine side effects. So, if mild side effects usually last only a day or two, mild side effects on vaccines include. So, amo ni siya ang mga side effect nga mild lang, nga pwede lang siya within 1 or 2 days lang. Aring redness, swelling, or itching at the injection site. Kung magkatol-katol, nagapula-pula, gahubag. Tapos, a purple spot or lump on an injection site. May spotted siya dito, nagapula. Tapos, nagasakit ang ulo. Headache, dizziness, daw katulgon, fatigue ka. Tapos, irritability or agitation, especially in children. Daw hindi mahimutang. Sore throat, dire yung lalamunan, nagakuan, mga kakate-kater. Runny or stuffy nose, sipunon ka, fever at 100 Fahrenheit, tapos nausea. Amo na siya ang mild. If you do experience this rare, more severe side effect, you should call your doctor. Di-include kani mga kuan lang ni sila. Rare lang kay ni sila no nga mga side effect. Back pain, kaparakit ang likod, blurred visions, or other vision change, chill, diarrhea, difficulty in breathing or swallowing, faintness of lightedness when getting up suddenly from a lying or sitting position. Daw, kung haling ka magpungko, pag tindong mo, malipong ka na. Mga side effect pa siya, pero rare lang kayo ni sila. Hives or welt that occur days or weeks after receiving the vaccine, itching, especially on the feet or hands, joint pains, loss of appetite, nausea and vomiting, numbness, or tingling of the arms and legs, bleeding of the skin, especially on the ear, face, neck, or arms, tapos seizure-like movements, tapos weight loss. So, amo lang ni siya ang end sa amon nga report.
So, okay, thank you. So, ayun. Stay healthy and be vaccinated. So, these are our references. So, thank you for staying up to here. Thank you for listening. So, we are the presenter. So, I am Arnella Shane Patadillo. Then, my other colleagues are Rosemary Gomez and Mr. Albert Bantolio. So, that's all. I hope you've learned something. So, thank you once again.
Nadula. Sino nadula, Rose?